Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Today we have a number of topics, including healthcare and cybersecurity, advances in cancer treatment, and some discussion of what can cause diabetes for certain people. Anyway, before we get there, I want to point out that down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for today's video. You can go to that newsletter and you'll find all of the medical journals, all the papers that I reference in medical journals. There's links to all of them. There's links to news stories. If I say that somebody published something, you'll find a link. The actions are in there. Actually, and at the bottom of the newsletter are a bunch of important medical references. What to do if a claim is denied, where do I go for abortion information, just tons of stuff. And other groups, I have links to other organizations that fight for better health care for all of us. So let's get started. Health and Human Services Department current approach to healthcare cybersecurity is self-regulation and voluntary best practices. It is woefully inadequate, and it has left the healthcare system vulnerable to criminals and foreign government hackers. Now, I didn't make that up. That's from Senator Ron Wyden of Oregon. He's the chair of the Senate Finance Committee, and he put that in a letter recently to Health and Human Services, and he's right. And, of course, the link in the newsletter to that, his letter, is there. Now, in December, HHS put out a cybersecurity strategy meant to support the sector. Several proposals in it were focused on hospitals, including kind of a carrot and stick program to reward providers that adopt certain essential security practices and penalize some that don't. And I think there was also financial help for some places that just can't afford to update their system appropriately. Anyway, I used to be a cybersecurity person advising the federal government, and one of the issues is that commercial healthcare software, it does generally have to protect HIPAA information. It does not have to prove that it's cyber resilient prior to release the way federal software must be verified. So that is, you can release the medical software, and if there's a leak and your HIPAA information is released, you can sue the company, but that's reactive, and it takes a very long time to get justice that way. It's better to be protected up front. And that's what the U.S. government does with their software. They are proactive, and they make sure that it is cyber resilient before going live. Now, it would be easy for a third-party company to verify a commercial firm's software prior to release. Of course, if you're selling software, having a third party attest to the security could be an important sales feature. Now, if you're interested in who can do this kind of verification, let me know in the comment field or send me an email to healthcareadvocacy1@gmail.com. And P.S., it's not me. I'm retired already. Let's talk about arsenic and diabetes. Exposure to arsenic and other toxic metals may accelerate the progression towards diabetes, according to a new study by the University of Illinois Chicago researchers. In a longitudinal study of over 500 Mexican Americans living in southern Texas, researchers found that high levels of toxic metals in urine predicted faster increases in blood sugar over subsequent years. And based on these results, individuals with the highest levels of arsenic in their urine were projected to qualify as pre-diabetic 23 months earlier and diabetic 65 months earlier than those with the lowest exposure to the toxic metal. So that's pretty strong evidence. Now, the study was published in Diabetes Care, and you can go to the newsletter, find the link, and go read it. It highlights an underappreciated risk factor for diabetes, a disease of immense public health significance that's associated with significant health disparities in conditions such as cardiovascular disease, kidney failure, and even blindness. It also emphasizes that this risk factor can be addressed by reducing exposure to contaminated food, water, and other products. Their study examined residents of Starr County, Texas, It's a region along the U.S.-Mexican border with one of the highest rates of diabetes and diabetes-related mortality in the country. Arsenic and other toxic metals have been detected in local groundwater, and these elements may also be ingested through foods and medicines. And there's a link to the University of Illinois report on this. Now, what they didn't mention in the research article was, how do you remove arsenic from your water supply? Well, carbon filters like Brita don't work. However, I include in the newsletter a reference from Dartmouth University on how to remove it. And there are a number of filters you can use, or filtering techniques. Alumina filters, reverse osmosis, anion techniques can help. I would point out that rinsing and boiling rice is also a good idea, and I include a link for how to manage rice with respect to arsenic in the newsletter. Boiling removes about 60% of the arsenic if you use lots and lots of water, like you do with pasta. Go read it. Rinsing only takes out about 10%. Forewarned is forearmed. Let's talk about prostate cancer and immunotherapy. New research has shown that immunotherapy can be an effective way to treat prostate cancer in men who are selected based on the genetic characteristics of their tumor. In a recent study conducted at Radboud University Medical Center, it was found that for some men with a very particular genetic type of prostate cancer, the progression of the disease was slowed down by 33 months. The study's findings are published in the Annals of Oncology. You can go to the newsletter, get the link to read it. While immunotherapy has not been widely successful for all men with prostate cancer, not by a long shot, a closer examination of existing studies does suggest that it can be very effective for certain patients. The researchers discovered that men who responded well to immunotherapy had specific DNA errors in their tumors. These genetic abnormalities cause protein changes that activate the immune system, making immunotherapy more effective. The study targeted 4 different DNA subtypes: MMRD, HTMB, BRCA-M, and CDK, I think it's 1,2I. The BRCA one, it should sound familiar. Anyway, they found about 15% of all, those DNA subtypes were found in about 15% of all prostate cancer cases. So this is not a wide spread of this stuff, right? It's just a small number. However, of the 69 men who were chosen for the study, they received a combination of 2 types of immunotherapy, ipilimumab and nivolumab, and as part of the study. The study found that the dual immunotherapy slowed the progression of prostate cancer in the selected patients by 4 months. The most notable response was observed in patients with the MMRD mutation, where the cancer was slowed, get this, by 33 months. And in some cases, this ranged from stabilizing the disease to reducing it to such an extent that it was no longer detectable in the blood or visible on scans. At the time of publication, the cancer remained under control in 20 patients. So the genetic testing, when they do a biopsy and they check for what kind of cancer you have, it seems like going forward, we're going to be doing DNA checking on the tumor cells to see what the appropriate therapy should be. Let's talk about Republicans and healthcare. I don't always like to get political, but I'm sort of being pushed in this direction. There was a news story today that Republicans want to cancel drug price negotiations. The Trump campaign's populist rhetoric on drug pricing is colliding with more traditional GOP concerns in Congress about heavy-handed governments squelching pharmaceutical innovation. So I have to tell you, in my humble opinion, that is just BS. And the reason I can say that is that I know that of all the drugs that have been FDA approved in the last decade, every one of them was funded by the United States government in research to get it going. Every one. So when they say they'll make less money and they won't do research, you can just call BS on that. Anyway, the tension surfaced this week when multiple high-ranking Republicans told Axios that they want to repeal the Inflation Reduction Act's Medicare drug price negotiations next year if they prevail in elections. There's a link to the Axios story there. I recommend you read it, and what you'll see is that it's the same garbage that they've been putting forward for a long time, except in this article, they admit they don't have a concept for a plan to do anything different. It's sort of just like that repeal and replace business they talked about for years related to the Affordable Care Act, which was all garbage. So first, I have advice for you. Vote accordingly this fall, up and down the ballot, because these guys do not have your best interests at heart. Then, I want you to note that this is part of a concerted plan by Republicans, and it is not a new strategy. This goes back a long way. Their plan, like decades, their plan is to overspend the federal government, like paying too much for Medicare drugs, and then reduce taxes so that the Treasury has insufficient input to meet government needs. Then they can claim that they have to start canceling safety net programs like school lunch programs and WIC and food stamps, because they believe that the poor don't have the initiative not to be poor. Now, I got to tell you, in Europe, people pay taxes like we do, and they have safety net programs that work, and they do not have the poverty and the homelessness that we have. If our safety net programs were sufficiently robust, we would not have the 11 to 13% poverty that we currently have. We would not have 80 million people on Medicaid because they are low income and cannot afford to get health care. If our safety net programs worked, everyone would have insurance that works from a public trust and at lower cost. But the greed and cruel tropes that this bunch has been promulgating for 50 years keeps us mired where we are. Look, let's take an action on this. Let's let our elected reps know that it is time for civil rights in this country. We need them to pass the Equal Rights Amendment, the Women's Health Protection Act, and let's put universal health care in place. You can contact them. I have a link. It's in the YouTube description box. Go to the link and just put in your address, and you'll get email and phone number locations for them. Or you can use ResistBot, my favorite way, and on your cell phone, send a text message to 50409. Here's the message: sign, SIGN, space, PTUYPI. Sign PTUYPI to 50409. Let me read you the message. I'm your constituent, and I want you to know that we have significant issues, and I want you to address them. I want you to take action to extend the deadline for the Equal Rights Amendment. If I don't see action from you or a public statement, then I know where you stand, and I will vote accordingly. I want you to take a public stand now for the Women's Health Protection Act to restore a woman's bodily autonomy. Again, if I don't see something or hear anything from you, I will vote accordingly. Lastly, I want you to move forward with universal health care so all Americans can get to the doctor when they need to. About 30 million of us have no health insurance at all, and the country will save $400 billion every year with a public insurance trust. This is actually according to the Congressional Budget Office. Thank you. That's what I've got for you. Down below, you can like, share, subscribe, send me a comment. I promise I'll answer them. You can also send me comments at healthcareadvocacy1@gmail.com. That's all one word, healthcareadvocacy1. Look forward to talking to you tomorrow. Have a good evening.